and we are studying for exam 2. This is going to be a part of studying exam 2 for maternity. And this is the class that I did not go to because of the exam for pediatrics. And I will not do that again because she took off 2% off my grade for missing her class. Isn't that amazing? Okay, so chapter 15, postpartum adaptations. Let's play this.
Well, if you haven't been scared off of having a child yet, let's see if postpartum can do it for you. Postpartum is not for the weak, that's for sure. And it's kind of the stuff that isn't shown on Instagram. So some ladies feel really blindsided. They had no idea that postpartum can be kind of rough. But that's probably part of our job too, to kind of explain more to them. So the postpartum period it's a critical transition for everybody in the family, both physiologically and psychologically. The puerperium period after delivery of the placenta, it lasts for about 6 weeks. Some people call it the 4th trimester. I wish we would probably focus on it a little bit more.
The 4th trimester.
But basically it's just saying that we need to pay attention to this period, that it's part of pregnancy and it's expected. Maternal physiological and psychological changes, just like there was a lot of changes to get us here, there's a lot of changes to get us back to our pre-pregnancy state. And then it's important that during this time there's a mother-baby adjustment that takes time for everyone to adjust to a new family member, but also the new roles of each family member. So we're going to go through each system just like we did with the pregnancy maternal adaptations. The reproductive system, the uterus goes through what's called an involution, which would just be like the uterus starts to contract. So those muscle fibers of the uterus will contract and kind of reduce the size of the stretched muscles. Catabolism occurs, which shrinks the enlarged individual cells of the uterus, so those myometrial cells. Catabolism will shrink those myometrial cells, and then regeneration of that uterine lining, so the uterine epithelium. This will, just regenerate a new uterine lining since all of it's getting rid of in the postpartum period. The uterus will decrease rapidly.
Okay, so this is where it asks us a question. So the question is, involution is the contraction of the muscle fibers of the uterus. This natural phenomenon, uterine muscle contraction, is the major factor in preventing postpartum hemorrhage. The major cause of postpartum hemorrhage is subinvolution or bad involution. Let me see this again. Involution is the contraction of the muscle fibers of the uterus. It needs to contract so it can close those vessels, right? Or whatever it's called. This natural phenomenon, uterine muscle contraction, is the major factor to prevent, that's why we massage the fundus, postpartum hemorrhage. The major cause of postpartum hemorrhage is subinvolution or bad involution.
Rapidly from 1,000 grams to 60 to 80 grams in size over a 6-week period. 1 hour after delivery, we expect the fundus, which is at top of that uterus, to be at the level of you. And then every 24 hours, the fundus should descend about 1 to 2 centimeters. On the 6th day, the fundus would be halfway between the symphysis pubis and the umbilicus, and then after 2 weeks, it really shouldn't be palpable anymore. And of course, this is super general. It varies per person. If somebody's had a lot of babies, we kind of expect that fundus to be above the umbilicus. But there's also been people with 4 or 5 babies and their fundus is way low. So it really just depends. These are just some general guidelines.
Okay, so it says, typically a uterine fundus lowers by 1 cm every day after birth. And I feel like didn't she say that? Or was it 2? I think it's true. Let me see. Are you sure you would like to check your answer? Yes. It's correct. So 1 centimeter every day after birth. So typically a uterine fundus lowers by 1 cm every day after birth.
The whole reason of the contractions, they're called afterbirth pains. So if mom's having contractions after the delivery, they're called afterbirth pains. They can be painful. They are increased with breastfeeding, so that produces oxytocin, right, when we breastfeed. And so this can promote more contractions. So some people will complain about painful contractions while they're breastfeeding the first few days to a week. But the uterus's main job during this 4th stage of labor is to contract and constrict the blood vessels, like to impede that blood flow. So think of that placenta and how big it is, and it's ripped off the uterine wall. So we have this big wound that can just bleed out, right, with big vessels. So the uterus will contract and constrict those blood vessels to impede flow. This is the most important way or mechanism to prevent a hemorrhage. And the risk of a hemorrhage is highest in the first hour after delivery, but it's present for like the next 6 weeks.
I didn't know it was the next 6 weeks.
So lochia is, let me just make sure this
is before already.
This talks about the fundus here and how it goes down per each day. So typically around, 24 hours after delivery, or 1 hour after delivery, the book says it should be at umbilicus, and then each day it will gradually go down. But lochia, this is the vaginal discharge that occurs after birth, and it will continue for about 4 to 8 weeks. It's the result of the involution or the contracting of the uterus, and it's just kind of getting rid of that decidua, like that lining in the uterus, as it becomes necrotic and kind of sloughs off. It's just getting rid of it. The amount will vary, and how long a person will bleed will vary, but each day the amount of bleeding should be less and the color should be lighter. Clients who've had cesarean births tend to have less flow because that uterine debris is removed manually by the physician. Immediately after delivery, lochia is bright red and consists mainly of blood and fibrinous products. But there's 3 stages of lochia. There's rubra, which is bright red and can change to a darker red, similar to the first few days of like a heavy period. This usually lasts around 3 to 5 days. And then the next phase would be lochia serosa, and this is a pinkish brownish color. It has blood, mucus, and uterine tissue, and that will usually last about 10 to 14 days after delivery. And then lochia alba is a creamy white or yellowish color, and that will last from the 3rd week to the 6th week. And it just is composed of leukocytes, epithelial cells, and mucus. At any stage, lochia will have like a fleshy or earthy smell. It shouldn't be offensive, like a foul smelling, because that would indicate infection.
Okay, so question is, lochia serosa is the first stage of postpartum bleeding. I think it's rubra, so I'm going to say false. Oh yeah, it's right up there. Duh. Okay, so let's go. Am I right? Yes, I'm checking this. And it says we are correct. Rubra, and then serosa, and then alba. Go back to figure out like what days, how long we're supposed to have that, because girl, are you listening?
So the cervix will change, and it won't ever go back. So this is the cervix of a person who's never been pregnant, and then this is the cervix of a person who's been pregnant. So once the baby is out of the cervix, it will get kind of bruised, and it starts to have this jagged slit opening. So the internal cervix returns to its pre-pregnant state around 2 weeks, and the cervical opening will widen and look more like a fish mouth, and then it will never return back to its pre-pregnancy circle shape. the vagina, once the ovarian function returns and estrogen production resumes, the vaginal mucosa will thicken and the rugae will return. And this usually takes about 3 weeks. The vagina will decrease in size and regain its tone after several weeks, but there will be dryness and coital discomfort or discomfort with intercourse. That's common until your menstruation returns.
It's common.
And then the perineum. The perineum here can become very edematous for the first few days. If there's lacerations or episiotomy, this can take about 4 to 6 weeks to heal, and the muscle tone may or may not return to normal, depending on the extent of the injury to the muscle, nerve, and connecting tissue. So this is, we talked about those degrees of lacerations. This would be like your 4th degree, your worst laceration, when it tears into the anal sphincter. And this can be difficult to regain. What am I trying to say? The tone of that. So, the muscle tone of that. So the swelling and the injury, as well as like swollen hemorrhoids, may make it really difficult to poop or to defecate, and even to get a really burning sensation there. So we put on ice packs to help reduce the swelling. We have warm water in these peri bottles that they can squirt while they're peeing, which will help the pain. We use like hemorrhoids pads that have witch hazel in them, and that will help decrease the swelling down there. We also use anesthetic sprays like lidocaine. There can be donut pillows or sitz baths, anything like that. This is extreme. But you can get these hematomas under the skin, which we'll talk about in a little bit. But that's why we want to make sure we're looking at the perineum so we don't get these, so that we know if there's these big hematomas type of thing. So obviously this is extreme, but the labia will get really swollen after a vaginal delivery, or can get really swollen. Cardiovascular.
Okay, the question is, what are some interventions the nurse can provide for pain relief for the perineum? So the peri bottle with warm water, witch hazel, numbing sprays, and ice packs. So all of it. Am I right? Woo! Then I'll go ahead and confirm. And it's all correct. Okay. All right. How do I do continue? Okay.
Vascular, dramatic changes happen here. So our blood volume drops rapidly after birth, and then it returns to normal about 4 weeks postpartum. The average blood loss for a vaginal birth is 500 milliliters. For cesarean birth, it's around 750 to 1,000. Just know that anything over 1,000 millimeters of blood loss would be considered a postpartum hemorrhage. Our hematocrit levels remain relatively stable. They can increase if there is a lot of loss of plasma, but it's not abnormal for them to decrease slightly. Our postpartum patients are typically really pale, but they're not like, their skin isn't cool to the touch. They're not sweating or diaphoretic. They're not symptomatic. So it's just this sudden blood volume drop that happens. You'll see that most postpartum women are pale, and then their color kind of returns in the next few weeks. We do expect still a slightly lower blood pressure, but our heart rate should stay about the same. If our heart rate starts to increase greater than 100, we should be thinking more like postpartum hemorrhage. And then...
Okay. So I didn't explain this well in the video. It is normal for a postpartum client to have a slightly lower heart rate. As the cardiac output gradually decreases after delivery, the maternal heart rate can decrease about 40 to 60 beats per minute for up to 2 weeks postpartum. This is important to note, especially if we are worried about tachycardia in our patients. Since we expect a lower heart rate, even if we have a heart rate of 100, we should investigate a little more. Okay. So the postpartum client is It's normal for the postpartum client to have a slightly lower heart rate. As the cardiac output gradually decreases after delivery, the maternal heart rate can decrease 40 to 60 beats per minute for up to 2 weeks postpartum. Give me 1 second. Okay, so I'm like coloring. Color by number, right? I forgot you can print out free things. Anyway, I'm doing a rainbow and some clouds. Anyway, let's go on. Continue.
And a rise in blood pressure should still be taken seriously because women can still get preeclampsia after the delivery of their baby. So we want to make sure that we're still kind of on that 130/80 alert. We shouldn't have too high of blood pressures even in this postpartum period. And then remember that headaches can also indicate high blood pressure. So if a patient's complaining of a headache, we really want to check out that blood pressure. The patient will have increased coagulation factors, so the clotting factors will remain elevated during the early postpartum period. Just remember, our body is preparing for this birth and for losing blood. And then our red blood cell production, hemoglobin and hematocrit are decreased slightly, RBCs are decreased slightly, and then they're slowly going to increase over time. Our white blood cells may increase just due to the stress of labor. And then it's not abnormal for the client's temperature to also increase. We're still going to keep that range of fever, right? It's like it still needs to be less than 100.4, but it's common for people to have a low grade temperature, like 100.4 or less, just due to stress and mild dehydration.
Okay, so it says a slight temperature elevation is normal during the first 24 hours after pregnancy, and that is true. I didn't realize that you can get preeclampsia even after giving birth, and then on top of that, like if you have a really bad headache, that could indicate that you have high blood pressure, which is like happening to my mom right now. Oh, my mom. Let's see, am I right?
All right, so the urinary system, our glomerular filtration rate and renal flow increase. We're going to be trying to get rid of all these extra fluids. Voiding can be difficult for some people. It's affected by perineal lacerations, which we just talked about, the perineum. It can burn when they pee. So again, we teach them to use that peri-pad to spray room temperature water on their perineum while they pee, and that helps with the burning. There's this generalized swelling and bruising of the perineum, so we do recommend ice for the first 24 hours after delivery. People can get hematomas. That's why it's important to visualize the perineum. They can also have tears in the surface.
Okay, so I had to figure out what a hematoma is, and a hematoma is localized collection of blood outside of the blood vessels. So it occurs when a blood vessel is damaged, causing bleeding in the surrounding tissue. So like trauma, surgery, blood clotting. It's like a pool of mostly clotted blood that forms in an organ, tissue, or body space. You can have like a subcutaneous hematoma, which is like located right under the skin, intramuscular hematoma located within a muscle, subdural hematoma located between the brain and outer layer of the brain. Oh my God, no. All right.
Bladder tone due to like if they had an epidural or a spinal. So sometimes they can't even feel that they have to go to the bathroom until that's worn off a little bit more. But this is a risk because we don't want our bladder to become overly distended. So a lot of times if they haven't peed in like 6 hours after delivery, then we're going to have to, we're encouraging it in that 6 hours. If after 6 hours, then we're going to have to put a straight cath in to empty the bladder. And then same thing, it's diminished sensation of the bladder, due to swelling, due to poor bladder tone, due to the numbing effects of regional anesthesia. So like in our C-section patients, we'll keep that catheter in until they have feeling in their legs and sensation in the legs, and they can walk to the bathroom.
Okay, so the question is, A postpartum woman's bladder should be non-palpable. And I feel like that's true. Hold on. Am I right? It says that is correct. It should not be palpable. Okay.
Bathroom safely.
Another question. The nurse should monitor urinary output closely the first 6 hours after delivery to avoid urinary retention. I say that's true. Am I right? Confirm. And that's correct. Should really closely monitor for urinary output.
So again, we talked about that glomerular filtration rate and renal flow increasing, but this is why we were trying to get rid of all those postpartum fluids, right? So there's a lot of IV fluids that are given during labor, especially if they were in labor for a long time. So we have extra IV fluids going in. We have a decreasing antidiuretic effect of oxytocin. Oxytocin is an antidiuretic, which will help you retain fluid for up to a week post-delivery. So a lot of moms aren't aware of this. They're not aware of how much swelling they're going to get even after delivery. And this is why we encourage them not to weigh themselves after when they go home, just because they have a lot of swelling still after delivery. There's a lot of buildup and retention of extra fluids during pregnancy, especially in that last trimester when you think you can't swell anymore. You just get a lot more swelling, especially in the legs and feet. So it's important for them to rest and keep their feet elevated when they can. And then there's a decreasing production of aldosterone. This is the hormone that decreases sodium retention and increases urine production. So all these things tend to lead to fluid retention, and it can take about a week or so to get rid of all that fluid. But this should definitely be part of your postpartum education. Teach them about the swelling, that it's normal, and that they probably are going to be peeing a lot more and sweating a lot more to kind of get rid of all that extra fluid.
Okay, so the nurse should educate the client to expect heavy to profuse diaphoresis for up to a week or two after delivery. Heavy to profuse, I think. I mean, I was really... Am I right? Confirm. That's correct. Heavy to profuse diaphoresis for a week or two after delivery. Oh, shit. Oh, no.
To kind of get rid of all that extra fluid. Our GI...
Another question. So the nurse should educate the client to expect heavy to profuse. I already did that, right? Yeah, I did. What the heck? I freaking can't deal with this. Why? Hold on. I'll skip for now.
Our GI system?
Okay, the nurse should monitor urinary output closely for the first 6 hours. We already did that one.
Our GI system?
Oh my God, why did it take us all the way back? Oh my gosh.
So again, we talked about that glomerular filtration rate and renal flow increasing, but this is why we were trying to get rid of all those postpartum fluids, right? So there's a lot of IV fluids that are given during labor, especially if they were in labor for a long time. So we have extra IV fluids going in. We have a decreasing antidiuretic effect of oxytocin. Oxytocin is an antidiuretic, which will help you retain fluid for up to a week post-delivery. So a lot of moms aren't aware of this. They're not aware of how much swelling they're going to get even after delivery. And this is why we encourage them. Our GI system just returns to normal pretty quickly after that, that big heavy uterus has gotten smaller. It takes the pressure off of the organs. You still might have decreased bowel tones for several days. Some physicians will prescribe a stool softener, especially if the patient's on narcotics, or if they've had some perineal trauma, just to help with their first bowel movement. There still is a decrease in peristalsis that occurs. Constipation can be common, especially if you do have a swollen perineum or a painful perineum. There is a fear going to the bathroom, and it does hurt. And so it's important to educate them that if they have sutures in their perineum, that they're dissolvable sutures. So they might feel them down there, but they should go away. Some girls will, like a suture will come out in the toilet and they freak out and they'll call. But anyways, that's that. And then hunger, thirst can occur just because they're usually NPO during delivery. So typically postpartum, we really, as soon as that baby comes out, we're like, hey, let's get you, what do you want to drink? What can we get you to eat? Kind of things like that. We're helping them out, get their energy level back up. Musculoskeletal systems, joints are going to return to a pre-pregnant state, except for the feet. It is true that a pregnant woman's feet can grow, not huge amounts. Some girls will say, they grow a full shoe size, but typically research says around 2 to 10 millimeters, which is about half of a shoe size after being pregnant.
8.5.
And then women commonly experience fatigue and activity intolerance for weeks after giving birth. And this makes sense because they're rebuilding their blood supply and they're sleep deprived, right? So, and then also like if they have any kind of extra blood loss or a hemorrhage or even just more blood loss than normal, it's going to take a while for them to get their energy level back up. So that's another important teaching skill is they shouldn't expect to have an energy level that they're used to because they have a decrease in these red blood cells that carry the oxygen, the hemoglobin, and so we just want to give them education on that they should give themselves some grace and that they probably won't have the energy level that they're used to for a good 6 to 8 weeks after delivery. And then abdominal muscle tone is diminished after birth. A lot of people will need some special exercises to return it back to normal. And then our skin, the pigmentation will fade and return to normal. Stretch marks will fade usually into like a silvery kind of look here. They don't typically go away, but the dark, like you'll see some dark purple, some dark brown stretch marks, those will go away and fade into more of a silvery look. And then like we talked about, diaphoresis is common. So they could be sweating a lot more. It's common for them to have night sweats when they're that first few weeks after delivery. Respiratory, this is probably the first thing a lot of people notice is they can breathe again. So as the abdominal organs return to their normal positions, the diaphragm returns to its original position. So the tidal volume, the minute volume, the vital capacity, and the functional residual capacity return to pre-pregnant values. Usually pretty quick, usually within a week to 3 weeks after birth. The diaphragm will return to a normal position and it relieves the pressure and that aching feeling in their ribs, and then it relieves that shortness of breath. So it really does feel good to take a deep breath again. In the endocrine system, the estrogen and progesterone levels quickly drop. Placental hormones decline rapidly also. And this rapid decline could be one of the causes of postpartum hemorrhage, especially if a patient really feels great, pregnant, really feels alive, then we lose those hormones so rapidly. It could be one of the reasons for postpartum depression. Prolactin levels will decline within 2 weeks if breastfeeding is not initiated. We're going to talk a lot more about breastfeeding, but breastfeeding will work on the supply and demand basis. So you have to stimulate the breast in order to let the body know that we need more milk, right? So the more that the infant can feed, the more milk the body is going to produce. And then the prolactin will increase if we're breastfeeding, or, stay stable. But if they're not breastfeeding, if this doesn't occur, then the prolactin will decrease and mom will lose her milk supply.
Are we done? Yeah, we're done. Wow, that 15-minute video turned into 30.